You're tuned to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on 101.7 FM Real Radio WCZR, and then we're podcast on Spreaker and distributed on its platforms. Jeannie Rowland, my co-host, is on with me from Indiana, and in the studio we have Dr. Rich Wyderski. He is a GP doctor, so general practitioner, primary care doctor, and he is now in concierge medicine. So we've done a little bit of podcasting about that, what concierge medicine entails, but now we're going to get it from the real live doctor who's going to tell us about the time spent with patients really, and as an end result, does give better care, in a lot of people's opinions, certainly yours and mine, Jeannie Roller. And I want to hear from the doctor what that really entails across the board on how we talk so many times about the big box medicine and what this concierge care can give for people and how you can go about getting this type of care, because that's what we all want. We want good medical care. The doctors want good care, too. I mean, they're stressed to the max, too, with trying to do this. They're working in the system that's, that everybody else is working in, that I don't want to say was thrown upon us, but that's what we've got, what we're dealing with. So, Doctor, thank you for being on, and I want to hear about this.
Yeah, thank you very much, Cindy. I appreciate you inviting me here today. And this wasn't something I ever thought when I started my career over 30 years ago that I would be doing. In fact, I always prided myself on being able to take care of people no matter what their demographic group, no matter who they were. And that's kind of the main ethic of medicine, is to take care of people for what they need, not who they are, to kind of completely separate yourself from everything other than addressing the needs of the patient. But more and more, partially because of the reduction in reimbursement, for example, in inflation-adjusted dollars. I just read this from an AMA newsletter.
Okay.
Medicare now pays 26% less than it did back in 2000.
Wow.
So, it's been 20-some years, and yeah, there have been some increases, but they haven't kept pace with inflation. And in fact, last year, for 2023, they dropped reimbursement by 2%, even though inflation has been at its high for quite some time now, for a couple of years. Mm-hmm. So you have to see more and more patients just to kind of stay even. And now that a lot of physicians are employed and no longer in their own private practices, you're told kind of how many patients you're going to see per day. And if it exceeds your capacity, well, that's still the standard that you have to meet. Mm-hmm. And so you don't really have a lot of choice. And there are a lot of boxes that have to be checked for insurance purposes, because although it's important to have high quality, sometimes there's too much of a focus on checking the boxes to make sure that things that help improve reimbursement kind of take precedence over what maybe the patient really needs that day.
Okay, so administrative over the patient care, per se.
Yeah, and it all came out of wanting to improve quality of care. So, are the patients with diabetes getting their eye examinations? Well, it sometimes takes a lot of time to get that documentation from the eye doctor to send it to your office so you have proof that your patient actually got an eye exam.
Okay.
But that's an administrative task that, there aren't just people around just to do nothing but that. So if I want to prove that I'm providing quality care, I have to spend the extra time just to do that one simple task.
Okay, yeah. And time is one of the big elements that we've talked about so many times on these podcasts, that you got, I'm being facetious, but you got 9 minutes with your doctor, if you will.
Yeah, and it's because there's a lot of behind-the-scenes time. So typically you'll get a 15 or 20-minute visit, but that's the face-to-face time. And even that has to include, usually, if the physician's really good at computer order entry and computer data entry, which I'm not.
Okay.
That all has to be done during the time that person is face-to-face. And that's one of the reasons why they're staring at the computer rather than actually sitting down with their patient, looking a patient face-to-face, talking about the things that they need to talk about together. Mm-hmm. Mm-hmm. And there's the background stuff, the web messages, the email messages, the refills, the paperwork that has to be completed, and so forth as well.
So we get that too. So you decided, after your 30 years of, in the whole system, to go to concierge medicine. So now you do spend more time with each patient, correct? Because you have less patients. That's
exactly right.
Okay.
I'm a geriatrician as well. I've been board certified for, about 25 years. But older adults who tend to have more medical problems, and not just medical problems, but other things going on in their lives too, that they need help with and directions to go in, and I need to work with agencies to make sure all the needs are met for my patients. It just takes more time.
Right.
And then one thing that really helps people to do what I ask them to do is for me to be thorough about explaining why something should be done. Mm-hmm. So don't just do it because I say it, because I tell you to, but here's the reasons why it's important to do, let's say, control your blood pressure more so than it's already controlled. So if we talk about it, my patient and I are on the same page about why we're doing something that we're doing, why this medication is the right medication to use, what the alternatives are. We make a choice together. All that's important, and my patient's more likely to follow through with our treatment plan if we've planned together. But planning together takes time.
Well, and the flip side to that in my mind when you're saying that, Dr. Rich, is so many times, and Jeannie and I have talked about this, in all honesty, the doctor's office will say, bring any questions that you have to the discussion. Well, you don't necessarily have the questions because you don't have the knowledge.
That's quite true.
So you're saying on your end, you have the knowledge, so you're putting that in the forefront, saying, okay, this is why we're doing that. This is the explanation, rather than me saying, okay, doctor, well, why would I have to do so-and-so if I couldn't think about to ask that?
Mm-hmm. Yeah, and that's very true. Sometimes even physicians don't know what we don't know.
Right.
So we, of course, try to study as much as we can to keep up on everything, but no physician can know everything about everything.
Yeah,
and so sometimes we don't even know what we don't know until we find out later that that we just didn't have the knowledge.
Right.
But we try to, of course, for most of the common things, we try to be very thorough in what's most common of what we see day to day. And that's why we have specialists who have much narrower but much more in-depth knowledge about their one particular area of specialty.
Right. So we've not negated that in our conversations, too. I mean, I'm not saying that everyone should go back to the best primary care doctor that there possibly is, and then you don't need to go forward with other specialists. It's actually, I think if I remember your conversation on another show correctly, that is when you do go to the specialist, because now you have more knowledge, you as being Dr. Rich and me as the patient, and saying, okay, now I know it's time for you to go to a specialist because I've spent so much time with you and I know that that's exactly what you need.
Sure, exactly. So I'm going to know about the more, let's say there's a symptom. Let's say it's shortness of breath. Mm-hmm. So, we've done the chest x-ray, we've done oxygen levels, we've done this and that and the other, and I've looked for the most common things that are most likely to affect that patient causing the shortness of breath. Okay. But we've come up empty, we haven't really found anything. So that's when I send my patient to maybe a heart specialist or a lung specialist or both to see if they can sort out why my patient's feeling that way. Mm-hmm. So they're looking for much more rare conditions that they know more about. Just as a general physician, even as a geriatrician, I just don't have that in-depth knowledge that they do of their individual specialty.
Mm-hmm. And we've talked about, too, some people get frustrated. Why so many tests, doctor? I don't know. I just had this test, that test, this test. Now we got more tests. But, I mean, that's how you do figure it out, even given that you've spent that much time with the patient all along. Yeah, you have to have an accurate diagnosis, because if you don't have an accurate diagnosis, you're kind of shooting in the dark when it comes to the treatment. And that's not necessarily good either, because treatments have their downsides as well. Right.
So we don't want to just do things randomly. We want to have a logical reason for why we're recommending a treatment.
Mm-hmm. Well, I mean, it's certainly less frustrating on both ends if it's more pinpointed, across the board. But it is frustrating, I know, for both sides. We have like a minute left, that you literally spend, like you said, 15 minutes or less. And everyone complains about it. It's not just me, you, whoever. It's worldwide, that it's just, where has that time and that interaction with the patient gone to, when we kind of know common sense that if you do spend more time, it's in any relationship. When you spend more time and more communication, you're going to have a better relationship across the board. Mm-hmm,
sure. And there's so many more things we do in prevention now.
Right.
So I would rather spend a lot of time going on prevention so things don't happen. And that takes time. So,
it does. It does take time. Okay, so on that note, I'm going to say, look at concierge medicine. I mean, there's different levels across the board. I mean, will we get back to that as the best healthcare? I'm hoping so. I mean, that's why we do these podcasts and stuff, because the more we talk about it, we're all kind of on the same page, doctor. I mean, you guys get frustrated on your medical healthcare end, and we as the patients get frustrated on our end. We all just are in it for the same thing, to give the best quality care. On that note, stay tuned. You've been listening to Planet Vero Radio.